This is Psychology 1 presentation on attention deficit hyperactivity disorder. This is created and presented by Rebecca Coronado, Kylie Brady, Asia Horsley, and Monique Porras. First off, we have Asia Horsley to talk about what causes ADHD as long as symptoms of the disorder itself.
The signs of ADHD hyperactivity disorder can be someone daydreaming a lot, forgetting or losing things often, squirming or fidgeting, talking too much, making careless mistakes or taking risks, having hard time resisting temptation, having difficulty getting along with others, also having hard times concentrating. The exact cause of ADHD is not fully understood, but research suggests that genetics play a major role. Symptoms of ADHD: predominantly inattentive presentation, predominantly hyperactive impulsive presentation, or can be both combined together. Usually you would see someone having a hard time staying on task, a hard time concentrating on what's in front of them. They have a lot of inability of being organized. They often talk too much about topics that aren't on topic. You should speak to a doctor. Symptoms can change over time, but when there's concerns or signs, signals, something that is alarming, this is the time to contact a doctor. A diagnosis can really help the person that is suffering from this disorder. The question is, what causes ADHD? Differences in brain development and function, along with environmental factors such as prenatal exposure to tobacco or alcohol and premature birth, may contribute. ADHD is caused by a combination of genetic factors along with how they interact. There is no single cause, and having a risk factor does not mean that a person will develop ADHD. Risk factors are not present in everyone with ADHD, may and can also occur in people without this disorder.
Now, on to Monique Porras, who will be talking about treatment and famous people who have been diagnosed with ADHD.
Hi everyone, my name is Monique Porras. My presentation is regarding the topics of ADHD treatment and famous people who have been diagnosed with the disorder. Beginning with the first slide of treatment for ADHD, including medications. There are several different types of medications, including stimulants and non-stimulants, that can help treat ADHD. Research does show that ADHD medications can help children, but they should be used carefully because they can cause side effects and interact with other medications. The stimulant medications may have side effects that could affect the child's health, such as difficulty sleeping and loss of appetite. Usually for treatment of medications for ADHD, it's recommended for children 6 years of age and older. Moving on to the next slide of ADHD, another type of treatment would be psychological interventions and new technologies. So in regards to the technology aspect, technology can deliver information to people in real time to help them change their behavior. And there's a couple more here on the next slide for non-drug ADHD treatments, including neurofeedback, cognitive training, several other ones here, and then there's a few explanations. These will all be additional treatments for ADHD. There is the combination treatment. So for this one, it's just a combination of behavioral therapy combined with medication. It does depend on the family's circumstances and needs to determine if this will be a best fit for the child or the family. Moving on to famous people diagnosed with ADHD. The first famous person I have here listed on the slide is Adam Levine, from Maroon 5. He's a musician. So for him, he was brought on board by Shire and two patient advocacy groups. They recruited celebrities like him. And basically what it was to help quizzes that they were conducting to determine if people had that ADHD diagnosis. It was help designed to encourage people to pursue treatment. So after he was brought on board. About 570,000 people took in this case, the everyday health test after the 2011 advertisement, including him. Moving on to another famous person diagnosed with ADHD, Michael Phelps. This is an athlete. He is, as you can see, he has several different medals that he's won. He is one of the best athletes in Olympic history. Next one is Simone Biles. She's also won numerous Olympic and World Championship titles, setting several different records. She is one of the greatest gymnasts. And then here on this slide, there's several other different famous people diagnosed with ADHD. So there's actors here, there's musicians, there's comedians, there's songwriters, there is basically multiple different types of talents within these famous people that have been diagnosed with ADHD. And then to summarize this, and in conclusion, I spoke about treatments for ADHD, including medication, psychological interventions, and the new technologies. For the famous people diagnosed with ADHD, I did want to make note that it helps the average person diagnosed with ADHD relate to them, being that they're famous. It kind of gives you a sense of comfort and a different type of feeling to know that although they're famous, they also struggle and they also go through the battle of this diagnosis of ADHD. Thank you.
Following up after Monique Porras, I will be talking about history of ADHD as well as cultural factors that impact ADHD. The history of ADHD started in 1798 when Sir Alexander Crichton, a Scottish physician, said the incapacity of attending with a necessary degree of a consistency to any one object, essentially declaring and writing and observing the first ever known case of ADHD, as that was his description of it without the specific label of ADHD. Just 4 years later, Sir George Frederick Still, a British pediatrician, wrote that in a normal defect of motor control in children. Essentially, he was saying that children could not manage or control their own behavior, yet they still have the same intelligence as anybody else. Once again, ADHD had not been officially labeled as ADHD at the time, but there clearly is records of it. In 1936, Dr. Charles Bradley used benzodrine as a medication, and he realized that it helped the youth with their performance and overall behavior when focusing on certain tasks. Now, in 1952, the American Psychological Association released their first edition of the Diagnostic and Statistical Manual of Mental Disorders. This manual and release did not include ADHD, although it's still important to note because in this moment they weren't considering it as a real or current disorder within this time period. In 1955, a psychostimulant, methylphenidate, became popular as an ADHD treatment as the disorder was becoming more well known and studied, and apparently this drug is actually still used today. Now, in 1968, the second edition of the Diagnostic and Statistical Manual of Mental Disorders was released. It included a definition called hyperkinetic reaction of childhood. In a sense, this was ADHD, just once again, not with that exact label. Now, after 12 years, ADHD was officially recognized by the APA. Just 7 years after that, the Diagnostic and Statistical Manual of Mental Disorders finally recognized ADHD as ADHD rather than hyperkinetic. In the 1990s, there was a rise of ADHD diagnosis, and there are three potential reasons as to why. During this time, doctors were more capable of diagnosing ADHD because it's becoming more prevalent and there was more research on it. Another thing is that more people were becoming aware of ADHD and reporting their child symptoms. In the 2000s, there was confirmed to be 3 types of ADHD. Number 2 was predominantly inattentive, essentially someone who can't pay attention, as it's in its name. And the third is hyperactive impulsive, and that's essentially the opposite, which means they are impulsive, they act out, and they can't pay attention, they keep fidgeting, they move around a lot. And the first type is a combined type. So it's two three put together. Now, in 2020, researchers look at environmental and genetic factors, and they have found that there is genetic links. Although it seems today more people are focusing on environmental factors as well. What comes along environmental factors is cultural factors. And for the first part, I broke it up into three things: recognition, expectation, and evaluation. Diagnosis of ADHD relies on a subjective interpretation. So, depending on how a parent may explain to their child's doctor about how they behave, can lead to different results of their child's determination if they have ADHD. Once again, that goes to parental bias and how a parent sees their child's behavior. That also comes down to societal norms and environment of how they were raised, and once again, how the parent perceives the child's behavior, if it could be a sign of ADHD, and if that's just something that they believe in and that may be the root cause of it. Now, another thing to consider for cultural factors is treatment. According to some research, there is disparities of under and over treatment in people of color, and that leads to issues and even stigma about ADHD and medication. Another thing that comes along cultural factors is different perspectives on cultural factors and ADHD. Race, Culture, and Ethnicity is a book written by multiple authors that have the belief that ADHD is a mere social construct that stems from a history of prejudice due to some people's greater production of melanin within their skin tone, or that their primary language is not English. And this most likely comes from the idea that if we go back to the fact that children of color are more likely to be diagnosed with ADHD than their white counterparts, this might be because of prejudice, and if they're acting out, it may seem as if something's wrong with them, which may lead to a false diagnosis of ADHD. Another thing is the Cambridge University Press. They suggest their own hypothesis that hyperactivity is not a social construct nor genetically passed down. They did mention and acknowledge that there is genetic links to ADHD, but they expanded more on that idea and focused on the social influences of the world. The decision-making process when identifying ADHD can be shaped on personal experiences and cultural perspectives, which may include fear of stigma, negative views of ADHD medication, different levels of tolerance for certain children behaviors, and for some people of color in their communities, a long history of mistrust toward their healthcare providers. Another thing is teachers' behaviors assessments are subjective as well, because teachers will obviously spend a lot of time around children if a child goes to public school, but these can be influenced by race and ethnicity and cultural backgrounds of both the teacher and the student, which leads to issues when diagnosing ADHD and its accuracy. So both of these ideas in mind, we really have to consider when someone is diagnosed with ADHD, what caused that diagnosis, what cultural factors may have actually impacted that and led to that diagnosis, because no child's case of dealing with ADHD is the same. That's all for my section of the presentation, and now I'll be handing it off to Kylie Brady.
Effectiveness of ADHD. Although ADHD cannot currently be cured, research consistently shows that symptoms can be successfully managed. Treatment helps improve attention, decreases impulsive behaviors, and strengthens daily function. Experts recommend personalized treatment plans because every individual experiences ADHD differently. Studies also show that in the beginning of treatment, early improves academic success, emotional regulation, and quality of life. Slide 2. ADHD treatments. Stimulant medications remain most effective treatment for reducing ADHD symptoms. Non-stimulant medications are another option for people who cannot tolerate stimulants. Behavior therapy teaches coping skills, organization, and emotional regulation. Exercise and sleep and good sleep habits and structured daily routines also has improved attention and exclusive function. Slide 3. How effective are ADHD treatments? Recent reviews continue to show that stimulant medications remain gold standard for ADHD treatment, improving symptoms for approximately 70 to 80% of individuals. However, combining medication with behavioral therapy provides that the greatest improvement because therapy teaches long-term skills while medication improves daily attention and impulse control. Slide 4. Challenges of treatment. Although treatment are effective, they are not perfect. Some individuals experience side effects such as decreased appetite, sleep problems, or anxiety. Others may need several medication adjustments before finding the right option. Because ADHD affects people differently, healthcare providers monitor treatment regularly and make changes when necessary. Slide 5. Most updated ADHD research. Researchers are moving more towards precision in medicine, meaning treatments tailored to each person's biology rather than using the same treatment for everyone. Advances in genetics, brain imaging, and AI are helping scientists better understand ADHD and predict which treatments may work best. Slide 6. ADHD digital treatments. Technology is becoming an important part of ADHD care. Digital therapeutic programs help improve attention through structured computer-based activities. Smartphone apps help track symptoms and medication use, while telehealth has expanded the access to behavioral therapy for many families. Slide 7. Genetics and brain research. Modern researchers show that ADHD is influenced by many genes rather than a single gene. Many brain imaging studies have identified difference in networks' responsibilities for attention, planning, and impulse control. Scientists hope to discover will eventually allow doctors to personalize treatments based on biological markers. Slide 8. Future directions in ADHD. There's a quote that says, "The future of ADHD treatment lies in precision medicine and individualized care." While current research is focused on improving quality of life through earlier diagnosis and treatments tailored to each individual, scientists are working more towards therapies that produce fewer side effects while improving attention, exclusive functioning, and emotional regulation. These advances may transform ADHD care over the next decade. Thank you.